Dr. Karen Knudsen, a biological sciences PhD from UC San Diego and a Temple University MBA. She's a global leader in oncology and healthcare, becoming the first female CEO of the American Cancer Society. Now she's at the helm of the Parker Institute for Cancer Immunotherapy, racing to turn all cancers into curable diseases. Dr. Karen Knudsen is in the Changemakers spotlight. Karen Knudsen, thank you so much for being a changemaker and for joining us here at the CEO Summit. You were the first female CEO of the American Cancer Society in its more than 100-year history. You didn't come from a family of physicians or scientists. What brought you into a career in medicine?
Yeah, I think for me, what I've always wanted to do, whether it's as a scientist, whether it's as a health executive, the CEO of the American Cancer Society, or now the Parker Institute, it's to get innovation to people. We're at this moment in time where there is so much discovery that's happening. The pace of change is truly logarithmic. And yet too many great ideas don't ever make it off the laboratory floor. So as a scientist, I was very focused on translation, what we call translational research. My area of expertise is actually in advanced prostate cancer. And I was fortunate enough to make discoveries that actually changed practice. And that was an important lesson for me then in wanting to lead and inspire others to have that same experience to improve health. So as a healthcare executive running oncology for one of the largest health systems in the US, you wake up every day thinking about how you can translate the science that you're running into the patient care that you're seeing every single day in my teams, and that's in the form of clinical trial and getting innovation to people. I actually loved that. I thought I would do that my entire career. And then the American Cancer Society came calling. They had been 100 plus years as a federated model. They wanted to think differently about their place in oncology and their place in patient care. And I had done quite a lot of merger and acquisition in healthcare. So for me, it was like coming into a fresh merger that was in need of business transformation. So although I was delighted to be the first woman in 100 plus years of any iteration of ACS to run the American Cancer Society, I actually think the more important thing is that I came from oncology. I was the first to come from oncology. And so we spent 4 wonderful years, I'm so proud of my team, transforming that organization to center around what modern era patients need, measurably improving lives, which we did through research, advocacy, and direct patient support, my biggest teams around the country, toward the goal of ensuring that we could end cancer as we know it for everyone. It was just an incredible journey.
What led you to find a passion for medicine and then oncology? Where did it all start?
Yeah, I grew up in a military family. I was not surrounded by scientists or physicians, really, for that matter, but I just inherently loved discovery, naturally curious, always gravitated towards math and science. And I thought at the time that if you loved math and science, that you had to become a physician. So I actually went to college thinking that I would become a physician, and was working in a laboratory. And my professor at George Washington University at the time said, you should really think about spending a little bit more time in depth in research. So I took a summer internship at the National Cancer Institute in Frederick, Maryland, which is on an Army base, so that looked like very familiar territory to me. And this was in the 80s when the AIDS epidemic was, in full swing. And there was so much interest in trying to understand retrovirus like HIV. And so I went to a lab that was actually using retrovirus as a way to study cancer. I won't get into the scientific details of that. But it got me very interested in that direct line. How does what I'm doing right now in the laboratory have an opportunity to impact a life? And I got hooked. And I never looked back. So for me, it was always about the science discovery and ensuring that fewer people are burdened by cancer.
What's so interesting to me about your journey is you could have gone into research and medicine And you mentioned your focus on cancer and prostate cancer, but instead of just focusing on that, you got an MBA.
I did.
What led you to that decision?
Yeah, that was probably one of the more unexpected decisions. And I'm not sure I'll forget my husband's look when I came home one day and said, I'm going to go get my MBA. And it was when I was in academic medicine, and we were initially a 3-hospital system in Center City, Philadelphia, with arguably one of the best cancer centers in the U.S., an NCI-designated cancer center that I was leading. But because of all the consolidation in healthcare, we went under this incredibly entrepreneurial, innovative, change-making CEO, Dr. Steve Klasko, that I reported to. We went on this merger and acquisition tear. And I would literally wake up every day and find myself with 3 new hospitals and think through how it is that we were going to learn about the patients being served by those systems. How are we going to ensure that we had the same quality of care across every aspect of the system? How would we get everyone to see a higher vision? And what's the role of each person in the business, the specialist, the generalist, the nurse practitioners? How are we going to make that all happen? And what I saw was that academic medicine did merger and acquisition in a way that I felt would benefit from learning from other disciplines. So I went back, I got my MBA and just learned from people who were already executives as I was. We all learned and leaned in with each other. And I have to say, it was just transformative for me. And I felt then very ready to take on the American Cancer Society as it had gone through this merger that needed to then be followed by a business transformation and develop the strategy that was going to allow it to be successful and impactful.
So you learned to think like a doctor, and then you learned to think like a business person. How do you lead?
Yeah.
How do you approach problems?
Yeah. So, what I think is there's so much benefit of being a scientist to then applying that to business. You feel very comfortable with hypothesis generation, right? And what is going to be the next thing for my business? What would have to be true in order for us to succeed in this new era, or if we want to be a new entrant, or if we want to grow in this market? You're very comfortable with hypothesis testing. You're very comfortable developing a set of success metrics that will let you know. And you're very comfortable designing that go, no-go business strategy that's going to tell you whether or not you're onto something or you need to retract and quit. So I think there's so much overlapping mindset between being a scientist and being a business person. And that's really what I think about when I'm thinking about business transformation and design. What are we trying to solve for? What is that business case? And what differentiates us? Why would someone work for us? Why would someone want to partner with us? Why would someone be attracted to what it is that we do? Is a discipline that's true in both the not-for-profit and the for-profit world. Healthcare is, yes, it's a not-for-profit entity, but at the end of the day, you do have to generate margins so that you can conduct all the services that are not reimbursed. And so that business discipline is baked into academic medicine. It transfers very well into now not just in my role at the Parker Institute, which is where philanthropy meets venture capital, but also in my role as a board member on early stage companies and a large cap pharma.
Yeah, I want to get to all that and hear about what you're working on right now. But first, I want to talk about your work at the American Cancer Society, because you really led this organization through transformative growth. You significantly expanded research investments, advocacy, patient support initiatives in a very short period of time. How did you decide amongst all those things what your goals were and how to prioritize?
Yeah, it's such a great question. And I think I was fortunate in my location. And what I mean by that is that ACS had been this federated model. So the American Cancer Society, the part I was touching and feeling, the Philadelphia version, was fantastic, right? When I needed extra research dollars to pilot a new idea, the American Cancer Society was a great partner. When we wanted to work on an advocacy initiative, and because they had a 501c4 where you can advocate at ACS, we could give them our patient stories and tell them why it was so important to have state plans for cancer screening, for example. Or for patient support, really critical. There are a large number of reasons that people don't survive cancer that have nothing to do with biology. Things like lack of access to transportation or lodging, These are things that the American Cancer Society helped us solve for every day in Philly. So I knew what good looked like, basically. So when I came to ACS and saw that under the federated model, there were just, as you would expect, many business variances that were happening across the country, I saw that there was an opportunity for us to really pull together as one. So the first year I called ACS Reset. We reset our mindset of where we were going to differentiate in oncology, where we could in modern era make a difference. The second year it was one ACS, where I asked the entire of the organization and the business strategy to function as one and to stop looking at the past and start thinking about where we could go. By the third year, we were really onto something. We were really growing. We had significantly enhanced revenue and the impact of that revenue. So I called that third year Amplify. Let's make more noise about what it is that we're going to do. And then my fourth and last year at ACS, I called Bold. And Bold was about big thinking. Bold thinking about what that next phase is going to look like as I was priming for what would be the next CEO. As I had successfully transformed the organization, that was really what I came to do. But also bold in what should we not be doing? Because medicine is changing, science is changing, technology will change part of that. And so trying to set up the organization toward that mindset that it's okay to transform and to constantly iterate.
One of your biggest accomplishments in 2023, for which you were recognized as a CNBC Changemaker, was this big partnership you made with healthcare delivery platform Color Health for screening and prevention. Why was that so important, and what led you to that partnership?
Yeah, this is so important for us, and to me, this is a perfect example of how overlapping interests between a not-for-profit and a for-profit can come together into something beautiful. So, a quick stat. In the U.S., we have 2.1 million Americans that are going to get a new cancer diagnosis this year. And unfortunately, 600,000 plus people who will die from one of the 200 diseases we call cancer. And while that's dire, and we've got a lot of work to do, we've had a 34% decline in cancer mortality since 1991. That was actually the high watermark of cancer mortality rate in the U.S. Why? If you unpack that 34%, the vast majority comes from prevention and early detection, which comes through screening, because we know that better outcomes live there. So we desperately wanted to get more people into prevention and early detection studies. Color Health's business model is all around this. And so Color Health had started out as an organization that would democratize genetic risk. Send you a kit, spit in a tube, send it back, clinical grade testing. Here is what my specific genetic risk of cancer looks like so that I can modify my screening plan accordingly. Beautiful model. I actually brought them on as an HR benefit when I was at Jefferson Health. So then fast forward to the American Cancer Society, they had gotten very interested in sending cancer screening home. And we know this is the future. And so I hate that phrase of skating to where the puck will be. I've got to think of something better. But this was my attempt at that. We had aligned goals of getting more patients into screening. We had aligned goals of reducing those friction points. And so we developed a partnership, a go-to-employer partnership, which has proven its weight. Those employers who have taken on the Color Health ACS partnership have seen a dramatic increase in compliance of cancer screening in their workforce, which is so important. Mid and large size employers right now that are self-insured are unfortunately seeing cancer as the number one cost of their healthcare. So this is, and everybody wins, all boats rise. And so just thrilled to death about that partnership, which I think was pretty first in field.
Yeah, a win-win-win. Thrilled to death, maybe not the best turn of phrase.
You're right, that's probably
Yeah.
the phrase I should retool.
Very thrilled, for that. So looking at everything you accomplished at your time at the American Cancer Society, the organization's revenue increased by more than 30%, broadened its impact to serve more than 55 million lives annually. What was the hardest part? And were there any mistakes that you learned from along the way?
Yeah, I think the hardest part was setting the vision and having the organization believe. At the end of the day, we weren't going to be successful unless there was a transition in mindset as well.
So how do you transform employees' mindsets?
Yeah, well, especially considering that in the not too distant past, it was 12 separate organizations with 12 CEOs and 12 strategies. You had to be there. So it was relentless on the road. I was on the road 49 weeks of the year for 4 years in a row. Because you really needed to be there to see what was so good in these various areas, apply that to the rest of the organization, to give the attaboys where they were deserved, to find the areas where there were opportunity when needed, where we could do better, and to listen to the organization. So I think that was the hard part, but most of that was done, most of the hard work there was done in the reset year. And by the time we hit 1 ACS, by the time we hit the end of that second year, I think we were really there. Mistakes along the way. I wish that we had attended, I think, more to thinking through our strategy for managing human capital and managing the incredible 4,000 people that were the American Cancer Society. It took a little while for me to really get an ace in to be our chief people officer, Andre Bocor, that I hired out of QVC/Curate. We would not have had the success that you just talked about, that 30% revenue increase, without an outstanding people strategy, so that we were, appropriately setting all of our internal goals, all of our internal compensation strategies aligned with the work that the people did and allowed them to really be operate at the top of their license, if you will.
Yeah, and so then you after accomplishing all these things in 4 years, American Cancer Society, you moved over to the Parker Institute for Cancer Immunotherapy, founded by Sean Parker, who many people know from his investment in Facebook and co-founding Napster. What brought you over there? What made you feel like that was the right opportunity?
Yeah, I have to say, there were a number of things that were in front of me that I was really very seriously considering, and then in walked Sean. And if there was anyone who ever deserved an honorary PhD, it's Sean Parker. I could sit in front of Sean and have a conversation at depth about the intricacies of immunotherapy, from basic science all the way through to implementation and manufacturing. He is a savant when it comes to this, and so passionate about this project that he started, the Parker Institute for Cancer Immunotherapy, where the vision was, and I very much align to this vision, we're making all these incredible discoveries, but they've got to get to people. Sound familiar, right? This is what drives me as well. And from his perspective, it was not enough access to capital. And I think he was absolutely right. So the whole philosophy of the Parker Institute is to, step one, collect the best brains, give them investment and funding to do the high risk, high gain, cutting edge research, which could fail, but could also dramatically transform cancer therapy. Give them the funds to do it. Let the bright minds be bright minds, but then help them 2 ways. Step two, help them by embedding in their technology transfer office so that someone's actually not just looking at the intellectual property generated by one investigator at one institution, but by how that actually connects to the other institutions and what could look like a value add or a synergy. Step three, form the newcos. So in the last 9 years, there have been 17 companies, early stage therapeutic companies formed. The Parker Institute has either been the lead investor or part of a syndicate for those 17. And the VCs have followed. The access to capital has followed. The model works. And I think it's because we've de-risked the science from the very beginning. We've seen it from the very beginning. We're not waiting for someone to pitch for us. And a little more than $4 billion has been raised in those companies. So I'm feeling very bullish about the ability to crank this wheel. Those companies have therapeutics in clinical testing, which is a win. That's a win for patients. For cancer, the most advanced form of care is clinical trial. Full stop. Will always be clinical trial. Full stop. So getting patients access to those potential life-saving therapies is key. And the next step, commercialization.
So you started off thinking like a scientist in medical school and doing medical research. Then you went to business school, started thinking like a business person as well, merging those two. What did you learn from Sean Parker, who thinks like an innovative technologist?
Yeah, what I learned is that someone even outside that realm has an appreciation for and wants to attend to a problem that too few people are doing. The access to capital, the getting those early stage companies created. It is difficult.
But is there something about his approach to problem solving that's different than what you had experienced before, his way of leading?
Yeah, I think he's a bold thinker. It's one of the first time that we sat and talked, for hours. What I really appreciated is he's unafraid of thinking differently. He's unafraid of thinking about different models like the Parker Institute. He's the chair of my board. So as CEO, I could not be more thankful than to have a chair of the board who's let's be bold, let's think differently. If we're going to fail, let's fail fast. But we're inherently baked in our business model is risk. And you don't always find that in the biomedical world.
So in your career, you've led all sorts of different organizations and worked in all sorts of different organizations. How have you evolved as a leader? How is your leadership style and your approach to what you're doing now different from maybe when you started off in your career?
Yeah, I think I'm a little more confident in risk taking. I think that's something that's definitely evolved over time. I think I have come to appreciate the incredible importance of having the right team and making sure that I'm delegating to those team members in a fulsome way so that they can truly lead, and expecting them to lead, I think, is something I have much more confidence in, my ability to put together that team. And I think if I have a secret sauce, maybe that's what it is just making sure I have the right team around me for the goals that we're trying to achieve.
In addition to in your organizations, you partner with so many different leaders across different sectors. What do you think makes a successful leader?
Yeah, I do think that is being open to all opportunities, that the good ideas can come from anywhere. It can come from a town hall of someone that maybe you've never met because your organization's that big, but they've got a great idea. It can come from those moments of ideation that happen over coffee right here at the CNBC CEO Council. We've had some today already, or on this morning's hike, that the good ideas can truly come from anywhere, and you have to be able to be receptive about hearing them and then making those strategic choices about which ones to implement based on what you're trying to achieve.
You've faced so many different challenges. Were there any mistakes along the way or particularly tough things you had to reckon with that you think about frequently or you really learn from?
Oh my gosh, that sounds like every day. There's something really tough we have to deal with. I think it's in part conveying the sense of urgency on behalf of cancer patients. There is a real need right now for us to do better. And I think that myself, the teams that I work with, we have that sense of urgency. We do move fast, but maybe recognizing that not everybody is going to go at that pace is something that I think I've had to learn with myself and my team to get us to understand what's the right cadence that we need to have right now to be successful.
Do you have any mentors, people you call when you have a problem or a question or you don't know what to do?
Oh my goodness, so many, and I'm very, very thankful for them. Some of them are here. Nancy Brown at Heart was just a fountain of knowledge. She's been CEO of the American Heart Association for quite some time. So there's a real need for the CEOs of the major philanthropies to get together and really learn from each other. Steve Klasko, who I mentioned, who is now at General Catalyst and went from academic medicine over into the venture capital world, is someone that I speak to really regularly. But I also surrounded myself at the American Cancer Society with CEOs from all walks of life. I had a CEO's council that was my hot dial, my personal board, if you will, where I had an opportunity to pick up the phone and call them about all matters, because there's some things you really just need to talk to other CEOs about.
Yeah, that's awesome, having that kind of community. Now, your work now at the Parker Institute comes on the heels of the NIH cutting hundreds of grants. The administration has proposed huge cuts to its budget. How does that impact your work and the work of others in your field?
Yeah, I think we are going to have to think differently. That's quite clear. Even prior to these cuts that have been proposed at the NIH and the National Cancer Institute, and then, of course, the potential challenge to indirect costs with cost recovery, which helps you pay for critical infrastructure for things like clinical trials. Even in advance of that, there's been a hydraulic not in our favor. And that hydraulic has been a deep investment outside the U.S. in R&D that's starting to threaten, my opinion, our competitive standing in the U.S. I did a panel at JP Morgan with a number of CEOs of biopharma companies who were talking about the ability to develop drugs overseas more quickly because of investment overseas, and the ability to launch clinical trials, accrue and complete that study overseas. This is, I think there are two kinds of impact that we're going to see. One is a change in our pipeline here in the United States from science and medicine and what we're able to generate. I don't think it's possible without even with just sustained funding, we may not keep our competitive advantage. But certainly with cuts, I don't see how that will happen. That's a longer term impact that we'll see on the economy in the U.S. and our competitive edge. But at the shorter term, we'll see impacts on patients because of the lack of access to things that our research, like clinical trials, which is the most advanced form of cancer care.
Yeah, we're almost out of time, but I want to make sure to hit a couple of key final points. How much do you think AI is going to be a game changer? Not just in your work, but maybe even in helping compensate for some of the declines in funding?
Oh, I think AI is a game changer already, and I'm very bullish about what that means in healthcare and in science. So on the scientific discovery side, certainly AI is already helping us, instead of make very large calculated assessments of data analysis. Instead of testing one hypothesis at a time, we can test millions in a minute. So without question, for drug discovery and technology, that's a win. But where I think it's a bigger win right now already is in healthcare delivery. Mm-hmm. This is not a scenario where I think of AI as taking someone's job, but rather I think about it plugging into areas where there is no job description for what someone is doing. Things like evaluating the person who's about to walk in your door for a clinical trial to see if they're eligible or not. That person doesn't exist at most places. So there are a number of ways we're seeing already AI come and fill gaps in the healthcare workforce. And we know already we're training too few oncologists. We're training too few oncology nurses. And this way, if we can give them capacity, allow them to work at the top of their license by allowing AI to fill in the blanks, we're seeing wins already.
That's fantastic. Now, I have to ask some personal questions because you seem to be doing it all. You serve on multiple boards, including AstraZeneca. You have 2 kids. You're traveling a lot. What are your secrets to managing your time efficiently?
Yeah, I probably have the greatest husband in the world, but we definitely made all decisions, as a family. And I think I like to think, because everything that I've done has been mission driven to do better for cancer patients, it's been a whole family vote toward that. Our kids are big hairy men now. They're out of the house. And, both have a strong interest in science. The little one's about to go to graduate school in biomedical engineering. And so, we've seemed to find a way to make it work. And just like in business, in the family, making strategic priorities about being together regularly.
And do you have any life hacks for all the travel you do?
Boy, I wish I did. I have a great life hack. Other than it's so important to make time to stay healthy. That is cancer prevention, right? To make sure that you're making time for yourself and putting that into your calendar. But I'm looking forward to a little less travel in the future state.
And just a final question about women and medicine. There's some amazing stats about how in 2022 women comprise 55% of medical school students, but more women physicians complain of suffering from burnout. How important is it to have female leaders in medicine and in research and in biotech?
Yeah, it's so important. And I have to say it was talked about on the stage earlier today, I think in the segment with the CEOs from Hart and from ADP, and I couldn't agree more. It's so important to have a woman in the role so that someone can envision themselves in being in that role. And you're right, more than 50% of both MD and PhD programs are women. Yet when you start to look at advanced ranks, full professor, dean, department chair, it starts to dwindle into the 12% or less. And that's been that way my whole career. So we've clearly got to do something differently. I think what you're doing in celebrating women changemakers is going a long way. So I want to thank you for that. And I am also feeling confident that the next generation will have even more female representation in science and medicine.
Well, you are one of those role models. Karen Knudsen, thanks so much for joining us here for this Changemaker Spotlight.
Thank you for having me, Julia.